Welcome, beautiful humans. Fadwa here from Midwife 360, making a video today on what we bring to the birth at home. Having a baby is a big deal for most people, like getting married. Planning a wedding, planning a birth is very similar. And many people want to be sure that they're safe wherever they decide to have their baby. Studies have shown that home birth is a safe option for the right candidate if you're healthy and low risk, and it may even be safer than the hospital for some people because you're less likely to get unnecessary interventions. Midwives who perform home birth for people carry a lot of equipment, usually to the birth, and basically it's all the same equipment that you would find in a level 1 hospital or a birth center. A level 1 hospital would be a hospital that you would not be able to get a C-section at. So we have oxygen, we have sterile instruments, we have suturing material, we carry drugs, and I'll go through all the drugs that we carry, and just a whole lot of supplies to help keep you safe and handle almost any event that might happen in a home birth. The equipment that I bring to a birth is, number one, my duffel bag. My duffel bag has equipment that I use at prenatal appointments when we do those at home, at postpartum appointments at home, and also some of the same equipment is used in the birth. The other major item is my toolbox, and the toolbox has other supplies as well as drugs and resuscitation equipment for the baby. So we're going to start with the duffel bag here, because this has the most basic supplies. And to start off with, essentially we have supplies that are needed to get vital signs. So vital signs are extremely important. They tell us that everybody is doing well. This is a wrist blood pressure cuff. And of course it's used to monitor mom's blood pressure, which we take on a regular basis throughout the birth. We have a temporal thermometer or a forehead thermometer, and we use that of course on mom and or baby once baby is born. There's what's called a Doppler or a fetal heart monitor. We're monitoring heart tones also on a regular basis throughout the birth, as long as it's okay with the mom for us to do that. We can listen to the heart tones in the water without any type of gel or lubrication for the tool, or we can listen with the gel or the lubrication outside of the tub. So that's the Doppler and a bottle of ultrasound gel. Next, I carry a good supply of non-sterile gloves. So you can see inside this pouch, I have my nitrile non-sterile gloves. And I also keep a little pouch of individual packets of KY jelly. One of my most important items that I bring is a very big clock so that we can see the time that the baby's born, the seconds, and that helps us know how much time has passed once the baby's been born, if we're doing a resuscitation, or when we have to look at APGAR scores at 1 minute and 5 minutes after birth. It helps us keep track of the time very efficiently. I do have a pouch with essential oils, and some of the oils that we carry are peppermint, clary sage, basil, cypress. Those are the key ones. Also orange, wild orange, and breathe. And you'll have to watch for another video in the future to get a little more information about how to use the essential oils for birth. Critical piece of equipment is a pediatric or infant stethoscope and a scale so that we can see what the baby weighs after it's been born. This particular scale is one that I've had for over 30 years. I have been helping moms have babies for over 20 years at home and in the hospital. And this, of course, we didn't use in the hospital, but I was happy to be able to get it out again when we started doing home birth. So you put the baby in the sling and you just hook the sling onto the hook, and you can weigh the baby like that. I also carry a bottle of urine dipsticks, although I don't use them very often anymore, only when a mom has high blood pressure. I also carry a pulse oximeter in my bag. And a pulse oximeter is a critical piece of equipment if you're needing to resuscitate a baby. Also, we use it in the 24 to 48 hour visit on the newborn when we do a screening called the Critical Congenital Heart Defect Screen, or the CCHD, and the pulse oximeter comes in very handy for that. I have a inflatable kneeling pillow for midwife comfort. And also in this bag is all my chargers for various items, like my underwater flashlight and the pulse ox and various other things. There's an extra flashlight in here and extra batteries for my Doppler and the blood pressure cuff and things like that. I also carry a headlamp. Headlamps come in very handy in dark rooms and also for suturing when you need a good spotlight. So my headlamp. This little item is called an icterometer. And an icterometer is used for deciding if a baby is jaundiced or not jaundiced. You press the little device against the baby's nose and you match the color that you see with these little bars, and it gives you a rough idea of the serum bilirubin so that you can advise the parents on whether their baby needs to have billy lights or they can just take the baby outside to treat the jaundice. A tape measure for prenatal visits to measure the fundal height. Extra thermometer, and pH paper or nitrazine paper to help determine if someone's waters have ruptured. It turns blue if it's amniotic fluid. One or two more pockets. We're almost done with the duffel bag here. There's even more goodies. So I carry a pouch for labs, just in case we have to draw blood or do a group B strep swab. I have all of the supplies in this little pouch that I need for that. Table's starting to get full. A couple of extra Ziploc baggies for placentas, taking placentas to someone who will encapsulate it. I carry a manual blood pressure cuff and a stethoscope, just in case the electronic one isn't working well. And another little pouch with a very rarely used staple remover kit, just in case we're doing a postpartum visit on a mom who's had a C-section. And lastly, I do carry a glucometer to check blood sugar, just in case I need to check a blood sugar on a mom or a baby. And it's just a little glucometer. All right, one last zipper. And in here I have some extra medications that don't fit in my other med tray. We do carry preservative-free vitamin K injections for those clients that prefer to have the preservative-free version of the vitamin K injection if they're getting the injection. And just various other medications I don't need to go into detail regarding. So that's the duffel bag. I'm going to put everything back in here and we'll move on to the toolbox. So we're going to move on to what I call my toolbox, my toolkit. The upper part is certainly much fuller than the rest of it. So this little tray right here has a number of different tinctures, herbal tinctures that we use for different things. Some of them are for augmenting or increasing contractions. Others help to calm the uterus. Others may help to the mother have a smoother transition. or ease her pain after she gives birth. So these are a number of tinctures. Some of them we just use to give the mom doses, others we sell to the mom and leave with the mom. Also an extra bottle of the perineal spray that we make here at Midwife 360 with aloe vera and witch hazel and various essential oils. It's very soothing for the perineum and also healing for after giving birth. This is a topical lidocaine spray, and we use that as kind of a pre-anesthesia for the anesthesia that we give if we have to suture. I have an extra tube of KY jelly, just in case we need that for pushing, and a 20 cc syringe, which could be useful for various things. Also, I have a collection of honey sticks, just in case mom needs extra energy in labor and she's not wanting to have anything that she has at her house. So that's the top tray. Okay, next we have seaweed. I carry a piece of nori seaweed in a baggie to give to the mom, which also helps for perineal healing, and 1 capsule of golden seal powder, which we use on the baby's belly button. And it helps with drying and to help prevent infection after the cord has been cut. I carry enough equipment and supplies in my kit to go to 2 births, just in case I don't have the opportunity to come back to the office and stock up or sterilize my instruments. I have enough instruments and supplies to go to 2 different births. All right, so next I'm going to show you all of the instruments that I carry. And these are all in sterile packaging. We do have an instrument sterilizer known as an autoclave here in the office, and after we use our instruments and we clean them, we sterilize them, put them in these sterile packs, and we have them ready to use for the next birth. So most of this stuff is either for suturing, for stopping bleeders if you're suturing. These are all suturing kits, and also we have kits for cutting the umbilical cord. And I do carry a set of ring forceps for other very rare emergencies. So these are the sterile instruments. I have 2 amni hooks. These are used to break the bag of waters. We rarely ever use them. I can probably count on one hand the number of times that I've broken somebody's water artificially, but we carry them just in case we need them. A laser thermometer that helps us monitor the temperature of the tub. More ultrasound gel, an extra Doppler just in case my other one fails. I have a bottle of castor oil that we use sometimes to do a vaginal check. It can help with a stubborn cervix or a swollen cervix. It can help to reduce that. More tinctures. Some more spray numbing. Again, medications. I have another vitamin K, and this is a Chinese herb that is used for postpartum hemorrhage. We try to be very thorough. Most of the time we don't use any of this medication and instruments. This is an underwater flashlight, and I have this mirror as an extra. We ask the clients to get a hand mirror so that when they're on their knees in the tub, we can use the flashlight in the mirror and monitor their progress as the baby is coming. But we have them get their own mirror so that it's a clean and unused one. I also carry Eldon cards. Eldon cards are blood typing kits, and you might have used one in your high school science class, but we use them to get a couple drops of blood from the placenta once the baby's finished with it to determine the baby's blood type before we leave the house. I have some little, what are called professional towels, physician towels, and small Chucks pads to use on my tray and my heating pad, and I'll show you those two things in a moment. And this box is really just for extra supplies, extra sterile gloves, extra umbilical cords, banding, extra 4x4 gauzes, in case we run out of the supplies from the postpartum kit that we've given the client to take home to her house. So I try to keep enough extra supplies in my kit so we don't run out of anything. Okay, now we're going to move on to the next portion of the toolbox, which is the medicine tray. Please bear in mind that home birth, you rarely need any of this stuff. Babies come out, it's a normal process, and we have all of this stuff for the just in case that everybody's always concerned about. So, notably in here is a homeopathy kit for childbirth. We use homeopathy quite often, just like we use essential oils and herbal tinctures. So carry an emergency homeopathy manual that I can refer to if I need to. We have Tylenol and ibuprofen, as well as ondansetron or Zofran for nausea. I have IV antibiotics. We carry ampicillin and clindamycin in case a mom is group B strep positive or she requires antibiotics because her waters have been ruptured for some period of time. Lidocaine is for perineal repair, so we can do that comfortably. Also, Zofran injectable in case we have an IV or we want to give it by IM injection. Various sizes of syringes for giving medications. Pitocin, very important for postpartum hemorrhage. Also Cytotec for postpartum hemorrhage. And we also carry Methergin pills for postpartum hemorrhage. In addition, we have the suture. We have 4-0 and 3-0 suture for perineal repair, and we have umbilical cord bands for the baby's umbilical stump. And that is everything that's inside my medicine tray. Alrighty, so we're going to finish up here. The rest of the stuff in the toolbox, we'll start with, this is the resuscitation kit, and it has what's called an ambu bag, and that's to give breaths to the baby. There's also a DeLee suction in here and some extra tubing, and what's something called an LMA mask, which is only used in a situation of a significant resuscitation, but we have all of that here in this kit. I do carry a tray and a instrument cleaning brush so that once we're done cutting the cord or suturing, we can get the instruments all cleaned up before we leave the house, and we bring them back to the office already cleaned and lubricated. These two squirt bottles have the instrument wash and lubrication that we use for that process that I just spoke about. Sharps container. This is a rebozo, and any doula or other birth worker has heard of this. It's a long piece of cloth, and we use it to work with the mom to position her body and shake her body a little bit to help position the baby if the baby's not in a good position. And the last thing that's in here is just some extra oxygen supplies, a mask for mom if she needs oxygen, and that's about it. The last few things that I'm going to go over are pretty important. One of them is a clipboard, just a standard clipboard from Staples or Office Max that also has storage. And this little life hack has been extremely helpful. So what I've done is I've taken The most important information that we need to document for a birth, there's several different forms here, 4 different forms in the protective plastic. We found that we can write on these with a magic marker and document when we're moving fast and we don't have time to type in the computer, or we have gloves on and we can't do that. And then we can just wipe it down with alcohol after and clean it off once we've transcribed the information into their electronic medical record. So if you either can't access your electronic medical record because there's no electricity, or for whatever reason, it's good to have a paper form of charting. And we have the clean print footprint cards, the same ones that they use in the hospital. And that's what they look like. And those are for afterwards, on the day 1, when we go back to the parent's house, we do just a keepsake footprint card for their baby, whether it's a baby boy or a baby girl. And the parents really love that. So it's nice to be able to give them a footprint. Additionally, I also have a couple more items here. One of them is a tray, just like you would have breakfast in bed. And what we use the tray for is to follow the mom around in case she decides to change locations in her house for where she's going to have her baby. So we put one of these white papers that I showed you earlier, and then I lay all of the vital signs, instruments, the blood pressure cuff and the thermometer, the Doppler, the Eldon card. We put our sterile gloves and sterile gauze that come from the mom's postpartum kit, and we put all those things on this tray, the instruments to cut the cord, etc. And we'll carry the tray around, follow the mom if she moves from the bedroom to the living room or whatever, if we think that the birth is imminent, and it just gives us a handy way to handle all of our instruments. This is my heating pad for doing the newborn exam, and with this I will cover it with one of these little Chuck's pads that helps to keep it clean for the baby. So we'll turn this on and we'll have it warm so that in case we do need to resuscitate the baby, we have a warm, solid surface to place the baby on. And after that, if there's no resuscitation, when it's time to do the newborn exam, it gives us a flat surface to check the baby out, do all the measurements that we need to do, and then diaper the baby. So these two come in the house for sure. There's a duffel bag that stays in the car. It's quite heavy because it's full of IV supplies. So this has 1 liter bags of IV fluid, 500 ml bags of IV fluid. It has a kit with the start kits and the catheters to start the IV, everything you would need to have an IV, including all the tubing and small bags to put antibiotics in when we're running in antibiotics. And it's good to have all of this stuff in the car. Most of the time we don't need it, but if we do need it, it saves the mom and the family a trip to the hospital. So that stays in the car. Here's the oxygen tank. With its handy case, we bring this in, we turn it on, we put it to the side, and we usually never use it. But if we need it, it's here and we have it. We have the tubing, and we also have an extra mask for mom in case she needs it. More often, we use oxygen for babies, and that is rare, but sometimes we use it for the mom as well. This is a collapsible IV pole, and that is pretty self-explanatory. That goes along with the IV supplies. And lastly is my work bucket. My work bucket has all of basically the dirty stuff in it. There's a can of wipes. We wipe all the instruments down. We wipe the tub down. We wipe everything down before we take it out of the house, before we put it away back into the kit. The sump pump is what we use to drain the water out of the tub. There's a few extra tools in here, some extra adapters for connecting the hose to the shower, just in case the family doesn't have what they need. I have some patch kit for the tub I've actually never had to use, and bleach for cleaning the pump. And that concludes everything that I carry in my car with me at all times, and either are inside at the birth or available for the birth, so that when you're a client of Midwife 360, you can have the safest at-home birth experience possible. Thank you so much for sitting with me throughout this video, looking at what I carry in my Midwife kit. We urge you to check out our website at midwife360.com, our Facebook page. We have a YouTube channel coming soon with birth videos, with this video, videos on how to set up the birthing tub, and more coming soon. So we hope to see you. Give us a call at Midwife 360 if you're interested in either pregnancy services or gynecologic services. We have a great team that's here and ready to help take care of you.